talk about how the body responds to hypotension. So here, this drawing here, I simply didn't have room to add it here, but you have um, you you have off the subclavian trunk and the left common carotid off the aortic trunk. Um, uh, a branch of internal carotid and external carotid, and your baroreceptor is found on the peripheral arteries of this internal carotid sinus, um, which is innervated by the glossopharyngeal nerve, uh, which is connected by the afferent nerve fiber from the uh, posterior solitary nucleus of the medulla. So let's say you have hypotension, you have decreased arterial pressure, so you have decreased stretch. Now remember baro. Baro means pressure, so it senses decreased stretch. And when it senses decreased stretch, it says, hey, let's slow down the baroreceptor firing because we don't need to squeeze those arteries any tighter to sorry, it says it decreased stretch. It decreases afferent baroreceptor firing in order to increase the sympathetic firing to constrict the vessels to increase the blood pressure. So the efferent fibers run through here to the SA node and connect to the AV node, and they increase heart rate. So as you can see here, it's also reflex tachycardia, increased BP for lower blood pressure. So you can see here the firing frequency of the SA node increases to increase O2 to the tissues. So, and also of note, if you stand up rapidly, there's a phenomenon you should know about reflex tachycardia, where the increased blood pressure compensates for decreased venous return, which the pooling of blood in the lower extremities can lead to cerebral hypoperfusion, which is why if you sit for a while and stand up, you can feel a little dizzy. Now back to control of hypotension. So the carotid sinus is senses stretch visceral to the internal carotid via the glossopharyngeal nerve, which is connected to the solitary nucleus of the medulla by the afferent nerve fiber, which stimulates sympathetic efferent firing to increase the blood pressure. Okay, so now we talked about how the blood pressure increases in states of hypotension. Basically, increased vasoconstriction by the efferent sympathetic nerve fiber stimulation, and which increases the firing of the pacemaker action potential to raise the heart rate, and also constricts the blood vessels. this is the increased efferent sympathetic firing. It also has an effect of decreasing parasympathetic stimulation, which leads to vasoconstriction and increased heart rate and contractility as well, which is so it all plays together. I'm sorry for this horrible picture. I hope that this was helpful. Just don't be confused with the chemoreceptors and baroreceptors. Baroreceptors sense low blood pressure and increase it. And when you have hypertension, it's actually why it's such a chronic disease, because the body doesn't really have that great of a way to lower hypertension, because there's no parasympathetic mechanism to to lower high blood pressure. It can release NO into the endothelial cells, but this is why chronic hypertension is usually treated with medications. So that's pretty much it with how your body deals with low blood pressure. Remember that there's a carotid sinus that senses stretch peripherally, and there is another aortic baroreceptor here, which also senses stretch. There's also an aortic chemoreceptor and a carotid body chemoreceptor. And these are stimulated by low oxygen and decreased pH of the blood. That's a little more complex. The purpose of this video was to explain baroreceptors in response to hypotension. Also, a little try before you buy here. It's a little mnemonic I like. The tricuspid valve is on the right side, and the bicuspid is bicuspid slash mitral valve is on the left side, because blood comes into the heart to the right first. So tricuspid and bicuspid there. It's a fun little mnemonic. So anything else about response to hypotension? Questions, comments, suggestions? I hope you enjoyed this video, and I hope to see you again. Thank you very much.